So, good day. I am Daniela Viancy Romanilas, and today I will be performing the return demonstration of initial newborn care. So, this is done to ensure the baby's safety, warmth, and stable condition right after birth. Now, prior to the procedure, I must wash my hands and prepare needed materials to save time and energy and to prevent contamination of microorganisms. Now, I'm going to properly identify the infant through the name band or the wristband. This is to ensure that I have the right patient to perform the right care and to prevent any errors or misidentification later. Now, I'm going to enhance the infant's comfort by keeping the environment warm, neither too cold or too warm, to prevent hypothermia and promote the stability of the newborn baby. So right now, the temperature is neither too cold or too warm, assuming that we're in a hospital setting. Then, I am going to place the linen on the weighing scale. So this is to protect the infant from cold surfaces and ensure the accurate weight measurement. Then, I'm going to wash my hands again before putting on my working gloves. So assuming that I'm putting a alcohol-based product. So this is to monitor the sterility and reduce transmission or spreading of microorganisms. Now I'm going to weigh the newborn correctly to provide the baseline data for growth monitoring and medication dosage calculations. Okay. Now, I'm going to perform the CREEDS prophylaxis. So I'm going to shade the newborn's eyes from light and open one eye at a time by exerting gentle pressure on the upper and lower lids to prevent unnecessary infection or irritation and ensure to safe application of the ointment. Now I'm going to apply the ophthalmic ointment from the inner to outer canthus, making sure the tip of the medicine tube does not touch the eye to prevent any infection of the neonatal baby and avoid contamination or trauma to the eye. So assuming that this is the ointment, now I'm going to do the vitamin K injection. Now, I have already withdrawn the 0.1 ml of vitamin K from the ampule, and I'm now going to inject into the middle third lateral aspect of the infant's left thigh. So this is to prevent hemorrhagic disease of the newborn by promoting clotting factor synthesis. Now for the Hep B vaccine injection. So assuming that again I have withdrawn the 0.5 ml of the vaccine, now I'm going to inject it into the thigh. To the middle third lateral aspect of the infant's right thigh. So this is to provide protection against hepatitis B infection at the earliest possible time. Now, I will carefully get the anthropometric measurements: the head circumference, the chest circumference, the abdominal circumference, and the length of the newborn baby to provide baseline data for the growth assessment and identification of any abnormalities. So I'm going to use my tape measure and measure the head of the baby. So assuming that it is in 33 centimeters for the chest of the baby, assuming that it is in 36 centimeters for the abdomen, it is in 35 centimeters, and for the newborn's length, it is in 36 centimeters. Now I am going to take the newborn's vital signs and any physical care, starting by assessing the newborn's temperature rectally. So this is to accurately measure the core body temperature to monitor the temperature of the baby. So the temperature, assuming that the temperature of the baby, it is 36.9 degrees Celsius. Now, I am going to put on the newborn's diaper, shirt, mittens, and booties to maintain warmth and protect the newborn from scratches and exposure from the world. So, since now I don't have any mittens or shirt or booties of the baby, I will just apply diaper, and assuming that I have already put on the baby's shirt, mittens, and booties. Then, now I am going to place the newborn, wrap the newborn securely with a clean blanket to provide warmth, security, and comfort. Now, I'm going to place the baby or the newborn in the crib with a drop light on and attaches crib tag. So this is to maintain thermal regulation and ensure proper identification of the newborn. Now, I'm going to take the newborn's vital signs to provide baseline physiologic data for health status monitoring. So, we are going to take the blood pressure, the respiratory rate, and the heart rate because a while ago, we already took the baby's temperature. So, now, I'll be assuming that I have took the newborn's vital signs by assessing the baseline. So, the respiratory rate of the baby is 50 breaths per minute. The heart rate of the baby is 135 beats per minute, and the blood pressure of the baby is 60/50 mmHg. Now I'm going to do aftercare to restore the unit order to prevent cross-contamination and ensure readiness for the next use. Now I'm going to record the procedure done and other pertinent data to provide legal documentation, continuity of care, and baseline records. Then lastly, I'm going to answer Related questions of the procedure to promote parental understanding, reassurance, and participation in newborn case.